How are you? I am Dr. Christy Del Castillo Heggie. I am one of the co-founders of the Fed is Best Foundation, and this is part of our series of video interviews of moms who want to share their real-life experiences with infant feeding to give you perspective on the needs of moms in the community. We have with us Sarah Christopherson. And hi, Sarah, how are you?
Good, great, excited to be here.
Great, thank you for doing this. Tell me a little about yourself.
Sure. I am the Policy Advocacy Director for a national nonprofit based in DC called the National Women's Health Network. I'm also the mother of 3 children. And before that, I worked for members of Congress for about 10 years, which is actually sort of important because later on, if I talk a little bit about my experience, you'd think that if someone who's been telling members of Congress they're wrong would be able to advocate for herself, and I didn't. So that's really key to my story.
So what were your expectations, and ultimately what was your experience with infant feeding?
So in all 3 of my cases, I expected to be great and natural at breastfeeding. I had this idea. I had seen friends breastfeed easily. That was not my experience any time. And each time I sort of convinced myself that the next time would be better because I would have magically learned everything I did wrong the first time. And just no amount of time or money spent with lactation consultants ever got that to be great. So when I finally sort of allowed myself with my children to formula feed, that was then the great natural, bonding experience that I had been missing when I was killing myself the first times trying to hold myself to that expectation that was just, for me, not going to happen.
So what were the experiences with each of your kids? Tell me, like, kind of your journey through each one of your kids.
So I tell a joke. My very first delivery was really hard. It was a really, really long, excruciatingly painful, hard delivery. And my child was whisked away immediately to the NICU, and I didn't see him for the first few hours, maybe even 8 hours. And when we brought back, I joked that our first fight was over our breastfeeding, where I tried to get him to reach and he pushed away, and I tried to get him in. So, memories are a little faulty, but that's sort of my experience, is that right from the get-go, things just did not go well. We could never latch right. We could never kind of get that going. Mm-hmm. With my first child, I then pumped for about 6 months. I have this really intense memory of accidentally having worn a dress to work, and accidentally because I hadn't thought about the logistics. So I'm sitting in a closet in the United States Capitol, stripped completely to my underwear, hooked up to a machine, trying to be on my BlackBerry, trying to watch the house floor, and just having sort of an epiphany of, oh, I'm not going to survive this. If I wish I could go back in time to that half-naked woman sitting in a closet and sort of say, to the extent that there may be benefits to breastfeeding, we actually don't know if there are any benefits to pumping, storing, freezing, right? Like, you can save yourself this and focus on the bonding time with your child. You'll all be happier, right? Like, but I didn't know that. I just felt this incredible pressure that I must pump. So that was experience number 1. Experience number 2 was lots of lactation consultants sitting in a room with a giant stuffed pillow nipple. Okay. And then, ultimately at some point, just finding myself stuck in traffic, pulled over to the side of the road with my baby sobbing hysterically while milk spurted everywhere, and we just could not make that work. And then with baby number 3, and I don't know how much you want me to get into this right now, but with baby number 3, we attempted to breastfeed in the hospital. I was at a baby-friendly hospital. I didn't know what that meant. I certainly wouldn't have thought that sounded bad. But they basically starved my child, made her so dehydrated that she couldn't give a blood sample. And after that experience, we just formula fed right away. So after the 3 traumatic days of seeing my baby so dehydrated that she couldn't give a blood sample, that they had to slice her heel, squeeze out a drop of blood, it would clot closed immediately, slice again, squeeze out another drop, she's crying hysterically, I'm crying hysterically. At the second they gave me my baby back, I ripped open a bottle of formula, fed it to her, and she went like this. Her hands instinctively clasped the bottle, her eyes got big. She was entirely formula fed after that. We weren't going to risk her health anymore with my failed breastfeeding attempts after that. So, I have friends for whom breastfeeding was a great, really positive experience, and I think that's amazing. Like, that's so great. For me, it was not that way, and my experiences of formula feeding and cuddling that baby and breathing in their hair, and that was what I really loved in the end.
What was she like leading up to the point where you discovered that she was dehydrated?
So, it's funny doing the work that I do in health policy. I sort of had a sense of what the medical literature on breastfeeding and the benefits of it, or the exaggeration of some of the benefits are, and yet sitting in the hospital, having just come out of major abdominal surgery, right, really dependent on hospital staff to help me bathe, to help me use the bathroom, to feed me, to give me pain medication. I was really out of it. Or maybe out of it's not the right word. I mean, I was mentally present, but I wasn't in a place to advocate for myself. And, at first, my daughter had seemed to be latching and nursing enthusiastically, but then she just got really sleepy. She wouldn't be roused to eat. The lactation consultant would say, try this trick, try that trick. It wasn't working. The lactation consultant would say, well, try again in half an hour. I'll come back and check on you in a few hours. It still wasn't working. She would, again, sort of nurse for maybe 60 seconds and then fall asleep and not be able to. And I just knew, I just knew it wasn't right. I could just feel it wasn't right, that she was so lethargic, that she was so disinterested in eating. But I kept waiting, and I finally at some point said, well, can I just talk to the pediatrician? And they sent in the lactation consultant. So instead of letting me be able to talk to the pediatrician and sort of raise these concerns of, isn't it time that we supplemented with formula, they sent in someone who, for personal reasons or for professional reasons, was not going to necessarily come to that conclusion with me. So I felt a lot of pressure to just not supplement and to just keep trying and to sort of push down those mama concerns I was having that things weren't right? To sort of trust the experts here. I'm in their care, I'm in their hands. And then finally, she became really jaundiced, and that's what necessitated the blood test, right? And we know that when infants aren't eating enough, that is often correlated with jaundice, right? So that's what necessitated the blood test. And it really was seeing my baby girl be held and cut repeatedly so that they could get a blood sample that really is about the size of a pen cap, right? That's how much blood they needed to take from her, and they couldn't do it. And just I thought, how have I let this happen? How have I ignored my own feelings that something is wrong? I know better. I know how to stand up for myself. I know how to stand up for my kids, and I didn't. Why? So then I felt this excruciating guilt, right? Why hadn't I just fed my daughter when I knew that's what she needed? So our ending, we had a happy ending. She's a happy, bright toddler walking around, getting into trouble. But it was so scary, right? In the beginning. So
it shouldn't have to come to that. You should have been listened to.
Right. And you don't realize till you're in the situation, when you're sleep deprived, when you're on pain medication, when you're recovering either from the trauma of a vaginal delivery or from a C-section, just how powerless you're going to feel in that moment, right? I wasn't prepared for that. I was really shocked for that.
No one is. Honestly, the most powerful person in the world can be there, and they are vulnerable, just like every other mom and baby. What piece of advice would you give yourself as a first time, second time, and a third time mom? What advice would you give yourself now that you know after your experience?
Bring an advocate with you, whether that is your spouse, your partner, your co-parent, your mom, your best friend. Bring someone with you who is not sleep deprived yet, who is not on pain medication, who is not dependent on hospital staff to feed them and bathe them and use the bathroom. Someone who, when you whisper, I don't think that's right, they're there to really stand up for you. And as a third time mom, my husband was at home with our other two children. It didn't, he was there for the birth, and then he went home to be with our kids. I didn't think I would need him there with me by day 2 or 3. And I really did, just to have someone, and he was amazing. He showed up in a business suit. And it was a Sunday, and I said, "Why are you wearing a business suit?" And he said, "Well, I'm a white guy in a business suit, right? Like, might as well use that white privilege to my benefit right now." And I thought, you're a genius, right?
It's true. Sad to say it.
It's true. But just having someone there who could help me when I couldn't help myself.
What do you think health professionals and health educators should do differently to support moms?
So I think it's a whole host of things. One of them is listen, right? Listen to moms, take them seriously. Don't shut them down. Don't poo-poo their concerns. The other thing is a little more structural, right? Like, we have to, and I'm a policy person, so I go to policy, but we have to write policies that reward nurses, doctors, tech for listening instead of pursuing, whatever their agenda is, right? So going to a baby-friendly hospital, which I had no idea what that was, meant that to use formula, I had to fill out this really coercive form that was sort of, you read it and it's like, well, good moms breastfeed, and only moms with HIV/AIDS should never breastfeed, right? Which even moms with HIV/AIDS actually can breastfeed. But regardless, right, the form was very much set up to make me feel like, oh my God, if I don't continue to breastfeed, I'm going to destroy her future, right? Eliminating those kinds of policies that force providers to coerce people into doing what they know isn't right for them is a huge step.
I totally agree. And you know what? Thousands of health providers feel the same way. They have to live the reality of policies, and they have to see with their own eyes the harm it does to moms.
Mm-hmm. Right.
And when you have a policy that puts your own job on the line and compromises your ability to protect your own patients using your judgment, using the patient's judgment, and respecting all of the needs of the patients as well as their autonomy. You have a policy that works against that. You have an unsafe and an unethical policy.
And, you know, for what we do professionally, what I do at work is really working to remove systemic barriers to reproductive health without coercion, right? So we are really, like, one of the things we work and talk about all the time, we meet with providers, is how to eliminate unconscious bias that, you know, might direct them to treat a white woman differently from a woman of color, or a wealthy woman differently from a low-income woman. We talk to providers about, or to not take women's pain seriously, right? Like, sometimes they'll, you know, a man will complain about something, they'll take that more seriously. So we talk all the time professionally through the National Women's Health Network about eliminating coercion, right? It was so eye-opening in some ways to live that, to then be on the side of someone who was being coerced and felt really powerless in that interaction with the medical community. So it gave me a renewed, I mean, I already was a believer in our mission, but it really did kind of give me a renewed passion for our mission of safe and effective healthcare without coercion. What a radical idea, right? So
I know. And sadly, we're in a time where it is a radical idea, but it shouldn't be. We should not be, this shouldn't be a problem at all to begin with, but it is. And we ought to be able to speak about it and change it. Oh, thank you so much. I think that's, was there anything else that you wanted to tell everyone just about infant feeding or anything else?
No, I mean, I think knowing ahead of time what you want and bringing somebody with you who can help you get it, and knowing to trust yourself when you're having that mama reaction of something's not right, I think that's really key. So thank you so much for the work you're doing and helping to sort of get the message out.
Thank you so much, and thank you for sharing your story and for doing the work you do at the National Women's Health Network. Thank you.
Thank you.